How's it going, everybody? Free Your Mind here. Rolling Stones post fake news because they're a fake news manufacturing website. And then there's a couple of people like Rachel Maddow and Reid who push misinformation but don't get banned off Twitter. I thought that's what we did. What happened to the New York Post last year when they Twitter deemed them posting fake information, false information that would hurt Hunter Biden? They deemed it was true factual information, but Twitter banned them regardless. In the guidelines, in Twitter's guidelines, you can't spread misinformation. So why is Rachel Maddow and Reid allowed to push false information that has been discredited? Rolling Stones, gunshot victims left waiting as horse dewormer overdoses overwhelm Oklahoma hospitals, doctors says. And as you can see, they used a fake picture. They used a fake picture there because it's a fake article and it's fake news. This is from January 26, 2021. And they decided to use it in September. Obviously, you can tell that photo's fake because in Oklahoma, it's probably hot as shit in September. So strike one. This is also a message from the NHS Sequoia, where the supposed doctor said he worked. Although Dr. Jason McKaya is not an employee of NHS Sequoia, he is affiliated with a medical staffing group that provides coverage for emergency room. With that said, Dr. Makia has not worked at our Salisa location over 2 months. Sacagawea has not treated any patient due to complications related to taking ivermectin. This includes not treating any patients for ivermectin overdoses. All patients who have visited our emergency room have received medical attention as appropriate. Our hospital has not had to turn any patient seeking emergency care. We want to reassure our community that our staff is working hard to provide quality health care to all patients. Now, who is this doctor? Who is this magical doctor? Ooh. And they had and the Rolling Stones had to post this update. Fake news. This week, Dr. Jason McKaya told KFOR the overdoses are causing backlogs in the Royal Hospitals. Of course, fake news publication Rolling Stones didn't fact check it all. They just went off the words of a crazy person who lied about it. And they updated it following suit, which is hilarious. And as you saw in the article, they updated. One hospital is denying in Oklahoma doctors claim that ERs are delaying care for gunshot victims due to overdoses of ivermectin, a drug being falsely peddled as a COVID treatment. We'll get into why they are so adamant on calling this drug horse dewormer, and you shouldn't take it. You'll see why in a minute. And they updated, that was the update. Update Northeastern Hospital System. Secretary issued a statement. Although Dr. Jason McKaya is not an employee of NHS, Secretary, yeah, I got you. And as I stated, Rachel Maddow comes out and says this dog shit. Patients overdosing on ivermectin backing up Royal Oklahoma Hospital's ambulances. The scariest one I've heard of and seen is people coming in with vision loss, he said. Fake news. Why didn't she retract it? She still hasn't retracted from 16 hours ago. Why hasn't she retracted? Because she's the same person that cried on air when the Mueller report was bunk, and the same person that pushed Russia. We have the info, but we never released it because it didn't exist. Russiagate. This is the person pushing the Russiagate on her fake ass news segment of hers, the Rachel Maddow Hour. And Newsweek just posting L's and fake news, pushing this conspiracy theory that ivermectin is not a possible treatment for COVID. Not telling you to go take ivermectin, YouTube. I'm telling you that it is possible that it could be used, but talk to your doctor about what's right for you, because I'm not going to be in charge of your medical anything, and I don't want to be any part of that. Newsweek, an emergency room physician said gunshot victims are having trouble. Yeah, we read this story. They published fake news. They haven't retracted it. Same thing with New York Daily News. Hospitals in Oklahoma are being overwhelmed with patients overdosing on ivermectin. That story is proven false. They haven't retracted it. The Guardian is usually okay. The Oklahoma hospitals deluged by ivermectin overdoses. Doctor says these publications refuse to fact check, and they're fake news. Fake fucking news. This also comes from, and this is also a part of this segment. The AP reports that 70% of recent calls to Mississippi Poison Control Center were from people who had ingested ivermectin to try to treat COVID-19. The correction acknowledges that it was actually only 2%, which is hilarious. They're trying so hard to say ivermectin is dangerous, that it's horse paste, but they're not giving you the full picture. There is ivermectin for horses. Absolutely, you get that at Tractor Supplies and feed stores. But there is human ivermectin. They really need to change the name. It is a dewormer for horses, but is an anti-parasitic for humans. That's what ivermectin is. That's what it is for humans. That's the difference of it. They really need to change the name of it, in my opinion, so there's no confusion by dumb people who don't do any bit of research like Rachel Maddow. Just fake news. We're going through fake news now. We'll get back to ivermectin, but I just want to show you the fake news that goes on with these stories and why you got to pay attention, why you got to do a little bit of research to uncover this. Pro-Trumper Richard Spencer's life is in shambles, and he's broke as his Charlottesville trial looms. This was posted September 6, 2021. It's funny that they say pro-Trumper. Do you know who Richard Spencer, the known racist, voted for? Richard Spencer for president and vice president. Joseph R. Biden, Kamala Harris. He circled that one in. So he voted for Biden. A known racist. Richard Spencer is a known racist. He's a known racist. He voted for Joe Biden. That's so funny. That's so funny they push this fake news. And now back into the ivermectin. Here's Joy Reid, just a outraged clown, posting fake news and spreading misinformation. Why isn't Rachel Maddow and Joy Reid completely off Twitter? They're pushing fake news. Why haven't they been banned off Twitter?
So things are clearly bad, but they're being made even worse by people who have refused to take the vaccine and instead are swallowing horse paste. The emergency room in one rural Oklahoma town is being overwhelmed by people overdosing on ivermectin, the horse deworming medication. It's gotten so bad that gunshot victims are having to wait to be treated.
So she either did zero research. Like, it's not hard to go on DuckDuckGo and look up the difference between horse ivermectin and human ivermectin. The differences. It's the first fucking one that comes up on DuckDuckGo. Or she is, what I assume is doing it on purpose. Rage bait for clicks, because she is a fucking establishment bootlicker peddling this dog shit. Ivermectin, a multifaceted drug of Nobel Prize-honored distinction with indicated efficiency against a new global scourge, COVID-19. In 2015, the Nobel Committee for Psychology or Medicine, in its only award for treatments of infectious disease since 6 decades prior, honored the discovery of ivermectin, a multifaceted drug deployed against some of the world's most devastating tropical diseases. Since March 2020, when ivermectin was first used against a new global scourge, COVID-19, more than 20 randomized clinical trials have tracked such imminent and outpatient treatments. 6 of 7 meta-analyses of ivermectin treatments, RCTs, reporting in 2021, found notable reductions in COVID-19 facilities, with a means of 31% relative risk of mortality versus control. Yeah, that took about 2 minutes. This took about 2 minutes to find. And it's hilarious when Joy Reid and Rachel Maddow on the same network, MSNBC, fake news, as fake news, and Rage Beatty as CNN. Yeah, it's funny when they do zero amount of research and just push this bullshit that just doesn't exist. This rage bait bullshit that doesn't exist.
Twice in my entire life, I have been embarrassed about purchasing something. The first time was when I had to buy tampons for myself. The second time was when I had to buy condoms for myself. And today, I'd like to say, is the third time I felt embarrassed about a purchase. Do you want to know what that is? Ivermectin. Ivermectin. I had to go to a feed store and get this for my actual horse. But all I could think about was people are going to think I'm eating this shit. And I was so embarrassed that I actually bought other horse items so people wouldn't think that I was a nut job. But I have to tell you that when this came across the register, the woman behind the counter smirked at me and then passed it back. Guys, stop!
That just screamed, I'm an idiot who watches only CNN and Rachel Maddow on MSNBC and Joy Reid does zero amount of research to understand that there's a difference between horse ivermectin and human ivermectin. There's a complete big difference. It's so hilarious. It is so funny. And now we go to veterinary versus human use. According to Dave Buran, ivermectin for animals is available in 5 forms: injectable, oral, liquid, powder, pour-on, and capsules, with injectable form by far the most common. Ivermectin for humans comes in pill or tablet form, and doctors need to apply for SAFRA for a Section 21 permit to dispense it to humans. You need to get a prescription for human ivermectin. Oh my god, people are so fucking stupid. Ivermectin has been used for many years for humans as a treatment for certain other diseases. It is relatively safe, but we don't know exactly that if we use it so regularly to treat or prevent the COVID-19, what the longer-term effects are. But also, it can have quite serious side effects on the brain if overdosed. You know, people can become blind or go into a coma, so it's very important they consult a health professional and that they follow dosage instructions they receive from health professional. There's a health professional, a doctor saying this. That is, there's a human and then there's a veterinary. Ivermectin. They really need to change the name. Now we get into the fake news before I tell you why ivermectin is getting pushed to the side. Just so you stick around, obviously. The AP just published one heck of a retraction. I would take any medication I am unfamiliar with until I'm consulted a doctor. That being said, the AP and the establishment press, more broadly, is clearly motivated to present a narrative. It is not motivated to tell the truth. Obviously, we found that out in the last couple of years. In an article published August 23rd, 2021, about people taking livestock medicine to try to treat coronavirus, the AP erroneously reported, based on the information provided by the Mississippi Department of Health, that 70% of recent calls to the Mississippi Poison Control Center were from people who had ingested ivermectin to try to treat COVID-19. State epidemiologist Dr. Paul Byer said Wednesday the number of calls to poison control about ivermectin was about 2%. 70 to 2%. Funny. Then you got the Washington Post. Republicans keep on trying to strip protections for pre-existing conditions. You see how these people project. You see how the Democrats and liberals and SJWs project. Opinion: do the unvaccinated deserve scarce ICU beds? I would say yes, because they're sick and they're people too. And this is how you know you're on the wrong side of history. This is how you know you're on the wrong side of history if you agree with these people. Why Satanists may be the last best hope to save abortion rights in Texas. You might be on the wrong side if you're with Satanists. And then CNN. Who can forget CNN? White supremacy with the tan. So the reason why they don't want you to take ivermectin is because it is not profitable for Big Pharma. It is very cheaply made and very easily produced. It is not in Big Pharma's best interest. What their best interest is to give you a shot or pills, now that they're pushing them, multiple times a year, make you take those shots that aren't as effective, and I'm not saying COVID shots aren't effective, this is just a hypothesis of what I think is happening. Take multiple shots of a vaccine that isn't as effective as it should be, to make as much profit as possible. And you can look at this hypothesis based on the Moderna stock price since, I don't know, March of this year. It's gone up at least 800%, between 200 and 800%, which is insane. Stock, like, make back when you're making money off stocks. Yeah, it'd be more it's like how they say it's more profitable to it's more profitable to treat cancer than to cure it. If you think Big Pharma gives a shit about your health or you living, you are insane. If you think the government gives a shit about your health, you're insane. They care about money and the underlying number of people. You're just a number to these people. Ah, boy. And also, ivermectin it's easier to just say it's a horse paste than actually give you the facts and actually, do a bit of research, because again, they want you to be on these vaccines. Not against vaccines at all. I'm actually vaccinated, but I don't know. It'd be advantageous in my mind for Big Pharma to lie to you and try to get you on the COVID vaccine instead of ivermectin. That's going to be a video, guys. Thank you so much for watching. I'll see you guys in the next video. Bye.